The following program, Know the Cause, is paid for by Mediatrician Incorporated.
If fungus causes cancer, why wouldn't those medicines help? Scientists at the German Cancer Research Center have discovered that the antifungal drug griseofulvin forces cancer cells into death.
If we look at it, from 1990, there were roughly, depends on the studies you look at, 1.5 to 3 million cases, give or take, of inflammatory bowel disease, Crohn's colitis, around the world, as per the CDC, being treated by a physician. In 2020, north of 7 million.
And so anytime a patient comes into the hospital that got torn up in the dirt, remember where the fungus lives. Yeah, the bacteria lives there, but the fungus lives there also. It's not about starving yourself thin. It's not about eating egg white omelets. It's not about these rice cakes. Do you remember rice cakes? Oh my gosh.
And here is a tip on how to handle your sweet tooth when you're on the Kaufmann diet. First of all, try substituting all your sugars. Get Kaufmann-friendly substitutes like xylitol, stevia.
For the past 45 years, I have dedicated my life and my whole career to finding the root cause of disease. And I now know with certainty that we must play a role in our own health care. I'm a self-care advocate, and you know what? Every time you change your diet for the better, exercise, or swallow a nutritional supplement, so are you. Now welcome to Know the Cause.
You know, friends, in the year 2017, I must have attended a half a dozen conferences where I was a speaker, both to lay people, and there were huge numbers, and to doctors. They get continuing medical education. And my topic was, and I can talk on diabetes or gout or any number of illnesses, but my topic at, I think all 6 or 7 of those, was cancer. Does fungus cause cancer? Does a fungal infection mimic cancer? And of course, my conclusion in all of them was yes. And so I'm a guy with a background who has studied cancer, studied tumor markers, and really try and help people with cancer understand that I think, and I'm not a doctor, I think we are grossly overdiagnosing cancer. Mammograms came along, breast cancer was like this. Now it's like this. You know, all this new technology, are we overdiagnosing? Okay, so does fungus cause cancer? Wouldn't logic dictate that if fungus caused cancer, that antifungal medicines would help cancer patients? I mean, that's the first thing doctors want to know. Well, wait a minute. There's a bunch, there must be 15 or 20 antifungal medications on the market today. If fungus causes cancer, why wouldn't those medicines help? So I wanted to show you the exact slides, maybe a little bit technical, but you're a smart audience. I want to show you the exact slides that I showed to the doctors. Here we go. Antifungal drug kills cancer cells. Scientists at the German Cancer Research Center have discovered that the antifungal drug griseofulvin forces cancer cells into death. Look at that, it was published in 2007 in a medical journal. Antifungal drug treats cancer. This was done at UT Austin. I love that place. ecancer.org it was published. The inexpensive antifungal drug slows tumor growth and shows promise as a chemotherapy for cancer. In trials on mice, thiabendazole decreased, which is an antifungal drug, decreased blood vessel growth in fibrosarcoma tumors by more than 50%, and it also slowed the growth of the tumor to a crawl. Wouldn't you think, just based on those two, but there's more. The one I'm really excited about is Sporanox, the toenail fungus drug. Antifungal drug treats prostate cancer. The antifungal drug used in combination with cortisone, it was called ketoconazole or Nizoral. Look at this, antifungal agent lowers PSA levels in Medical Tribune 20 years plus ago. Wouldn't you think every urologist who had a high PSA, and till the day they lay me in my grave, I'll believe the PSA is not a prostate cancer test. But wouldn't it be cool if every guy over 4.0, 5.0 went on Nizoral? It's an antifungal drug. I think it would help most get their PSA back down. I'll always tell women, don't get a pap smear if you're taking antibiotics, or you drank the night before, or you're drinking excessively. Same with men. Don't go in for a PSA test if you're on mycotoxins, antibiotics, and alcohol, because I think they can atypically elevate the PSA or the cervical cell count. Okay, Antifungal drug stops cancer from metastasizing by inhibiting angiogenesis. That's a process whereby a tumor breaks away from the breast and travels to the brain. Angiogenesis is a brand new plexus of capillaries that feeds that tumor. You don't want that to happen. You want to inhibit that. Here's an antifungal drug, and this is done at Johns Hopkins. Discovered to their surprise, I leave that in, that a drug commonly used to treat toenail fungus, Sporanox, could also block the growth of new blood vessels commonly seen in cancers. That's not all. Antifungal drug, skin cancer, basal cell carcinoma. If you have one of those, always talk to the dermatologist about fungus. Affect about 3 million people a year in America. A common antifungal treatment called itraconazole, once again Sporanox, may be useful in treating basal cell carcinoma. Wow. Antifungal drug treats cancer. A common, inexpensive antifungal medication has joined the ranks of drugs that may be suitable for use in treating metastatic prostate cancer, non-small cell carcinomas, as well as rarer cancers. The drug is called Sporanox. It's FDA approved to treat skin and nail fungus. Okay, I've got another one, but I'll go over that slide with you in a minute because that's a common sense slide. The rest of these are a bit technical. And I can see you sitting there at home going, gosh, that's kind of confusing. I don't really understand all of that. What this says is, I don't know how many antifungal drugs, 3, 4, 5 of them, are known to inhibit cancer. Is cancer a fungus? Because the medical community laughs at me every time I even approach that. Is cancer a fungus? Could that lump be a bolus? We call it an ascomycete or a mycetoma. Fungus gather together in a lump in the body. And the medical community doesn't know that. So look at this. Here's my common sense slide, my last one. From toenail drug to a cancer drug. It has been previously suggested that Sporanox inhibits the hedgehog pathway. I love that. Through a key regulator of this signaling cascade, maybe not. This paper ruled out that Sporanox worked by inhibiting this hedgehog pathway. So how does it work? Doctors, if I may say, might the reason that Sporanox works for cancer be the exact reason it works for toenail fungus? It kills fungus, and both are fungal conditions, says the Journal of Medicine and Chemistry in 2016. We have to come to our senses. Just talk to your doctor about the possibility that that lump or bump in your body, rule out fungus, that's all. My friends, I'm wondering, with a show of hands, do you struggle with irritable bowel disease or irritable bowel syndrome, uncontrolled diarrhea, constipation, painful bowel movements, constant pain, chronic fatigue, always worrying about where the bathroom is, anxiety that you might have an accident, medication dependence, being unable to enjoy real food? Josh Dech is your guy. He's from Canada, a friend of mine who had an irreversible tummy problem years ago, got it reversed. To the point where even his doctors are saying, this is great, whatever you're doing, keep doing it. And he had to go due north to a guy named Josh Dech, and I'll give you his information here before we exit. Welcome to the show, Josh. Thank you for coming all the way from Canada, and thank you for being our guest here today.
It's a pleasure to be here.
That's pretty heavy duty, uncontrolled diarrhea or constipation, and yet, huge number. We don't talk about this, you know. I notice even ads on TV, thicker toilet paper, underwear, that, you know, it's so amazing to me. Instead of fixing a problem, we go indirectly, you know, to a different approach. How many North Americans suffer like this?
Millions. So if we actually look at the data, I recently gave a lecture on this one. If we look at the information from 1990 to 2020 when it was last measured, if we look at, again, bowel disease or digestive disease on a spectrum of severity, at the worst end, it's inflammatory bowel disease, so Crohn's and colitis, which your friend had. It was ulcerative colitis, very severe, for 16 years. And doctors say, well, it's unfixable, nothing we can do. But if we look at the data, we have to understand their frame of reference doesn't make any sense, just even mathematically. They say these bowel diseases are, one, they're unknown cause. We call it idiopathic in medicine. Right? The other one they say is that it's either environmental or it's genetic. But if we look at the actual stats behind it, and I just figured this out one day, if we look at it, from 1990, there were roughly, depends on the studies you look at, 1.5 to 3 million cases, give or take, of inflammatory bowel disease, Crohn's colitis, around the world, as per the CDC, being treated by a physician. In 2020, north of 7 million. Now let's pull that one step further. This is where we're going to break the unknown cause or just genetic. It can't, if it's unknown and we've doubled, tripled, quintupled our numbers in 30 years, you better figure out the cause pretty fast, right? On the other hand, if it's genetic, we know the United States of America and Canada now, it's less than 5% of the global population, but that 7 million worldwide cases, 50% are in North America alone.
It's just, I read this and you know what makes me sad? 12-year-olds. We never heard of this in 40-year-olds, 50 years ago. I go back way beyond you. This was something that wasn't dinner conversation. You just don't talk about this. Today you have to talk about it because it's out there. Can it be helped? Dare I say, can you help someone reverse the symptomatology to the point where, like my friend, they go back to their doctor and they say, I don't know what you're doing, but keep doing it?
I believe all disease can be reversed. And the difference in the ideology is this. Doctors look and go, well, the disease is happening, therefore it is, as if the body just made mistakes, right? We're not designed to make mistakes. The body can heal itself. We just have to give it the resources and the conditions to do so. And so I look at it this way, Doug. Imagine I go to the hospital with a thorn in my hand, and it's swollen, it's infected, it's all red, it's bleeding, it's been there for months or years. If I went to the doctor and they gave me numbing cream for the pain, you'd look at them like they got 3 heads. It doesn't make any sense. You'd ask them to pull the thorn out of my hand. And when we have bowel disease and inflammation, no one's looking for the thorn. They just go, oh, you are inflamed, therefore here's a drug. Why aren't we looking for the thorn? And it's very easy to find. 90% of the cases that I see, give or take a few, are going to be mold or fungus.
Are you saying know the cause? Wouldn't
Ironically
that be a great
enough.
name for a television show? I love this graphic because in my mind, of course, I worked in clinical nutrition for decades. This is what I did.
Well, let me grab my pointer. So, number 1, remove the thorn, whatever that might be. Now, there's a lot of factors we can get into that. We have to, of course, replenish nutrients. One of the leading causes of bowel disease is vitamin nutrient deficiencies. We have to, of course, rebuild our microbiome. That's going to be the 100 trillion bacteria in your gut. Repair the damaged tissue, right? Like rubbing that heel rots while you're bleeding. And then the immune system is imbalanced. I need a longer pointer. The immune system's imbalanced. So we have to, instead of boosting it, we have to rejuvenate and restore balance so things aren't all over the place.
How do you know when a person has a nutrient deficiency? I guess all IBS or IBD has some kind of nutrient deficiency, but these people are just oozing. It's just, how do you know? Do you test in certain ways that enable you to look at a chart and say, aha, I think we've got it?
We can test, we can guess, or we can do symptoms. And symptoms are everything, and they can indicate more than doctors think they do.
So good to see you today. Thank you. For more information on Josh, his contact information is on gutsolution.ca. Gutsolution.ca. Way to go. Good job.
We've all been conditioned to think yogurt the minute we hear the word probiotic. But there's actually a much more important step to take before stocking your fridge with the usual suspects. If you're going to eat yogurt, make sure it's plain with no added sugar. To help strengthen your body's good bacteria, it's critical to reduce your sugar intake, and several yogurts are high in sugar. By getting rid of sugar and processed carb-loaded foods that turn into sugar in the body, you give the good bacteria in your system a leg up. But this alone isn't enough to give your gut what it needs. As important as it is to starve the bad bacteria, it's equally important to feed your good bacteria with prebiotics. Of course, probiotics are also important, but despite the media blitz surrounding it, yogurt just doesn't provide sufficient amounts of friendly bacteria. And as I said, the added sugar defeats the purpose. That's why I always recommend Dr. Ohhira's Probiotics. It's a blend of pre and probiotics that contains 10 different strains of live bacteria. Dr. Ohhira stands out because it delivers multiple bacterial strains that help to nurture a diverse environment in your gut. It is by far the smartest and most effective strategy when it comes to probiotic design. I'm Dr. Fred Pescatore for Know the Cause.
So the year was 1971. I get back from Vietnam. I was a Navy corpsman, trained in emergency medicine. Off to Vietnam I go, and I'm attached to the 7th Marine Division. What an amazing group of guys that was. What an amazing year. I come home and I have health problems, and I can't figure them out. And Dr. Hughes, I was working at USC Medical School, doing some consulting work with a doctor there by the name of Dr. Hughes, and he said, you know, you were in Vietnam, maybe you have a parasite. All these bizarre symptoms. I was bleeding at the folds of my skin and so forth. Stomach problems, hair coming out. And he said, why don't you go over to the library? We didn't have Google searches in 1971. Why don't you go over to the library, get a library card, and study parasitology? Maybe a parasite, a worm, a fluke got in your body. I thought, that's a great idea. Went over there, and as luck would have it, this 1953 medical book called Parasitology opens to fungus. Now, I'm covered with jungle rot. I've got itchy legs, itchy thighs, my arms itched, and so forth. Jungle rot's pretty bad stuff. And I believe it's a fungal condition. They say it's a mycobacterium, but anytime MYCO comes in, myco means fungus. So I'm thinking, okay, this makes sense. You mean that fungus on my skin, yeast, can get inside my body, and I can have a systemic throughout my bloodstream fungal condition? Don't you die if you have a bacterial condition like that? It's called septicemia. So I developed the Kaufmann diet. Crude as it was in the 1970s, it's come a long way, baby. I want to now teach you what it is and what it isn't, okay? The Kaufmann 1 diet, okay, all humans need fats, proteins, and carbohydrates. So we got the fat. Grass-fed meats, poultry, freshwater fish, avocados, nuts, oils, olive, etc. We've got protein. Grass-fed meats, range poultry, freshwater fish, eggs, nuts. We've got carbohydrates, carrots, beets, onions, yada yada. We've covered all those bases. Can you eat Kaufmann 1 and really have a healthy diet? Some of you have been on this diet for many, many years, you know, and look at me. I mean, I feel tremendous. I don't feel the 69 years old that I'll soon be. I feel, you know, maybe 29. So here's what the Kaufmann diet is not, because this is really important. I see these ads on TV and it blows me away. This isn't a packaged diet sold to you mostly in January to lose weight. It isn't a $50 size pizza. It isn't low-calorie eating. It's not low or no-fat eating. It's not based on a low glycemic, because we eat carrots, right? It's not about starving yourself thin. It's not about eating egg white omelets. It's not about these rice cakes. Do you remember rice cakes? Oh my gosh. It's not vegan or vegetarian eating, although I respect and have some dear friends who eat that way. It's not meat-free, and it's not lacking scientific evidence or support of proof. The diet, folks, is a diet that is a very good diet to follow for extended periods of time. When I followed that diet, I'm there working with Dr. Hughes and working with Howard Gottschalk, an ear, nose, and throat doctor in Los Angeles also, kind of going back and forth. When I was following that diet, I'd feel great, but I was a 22, 23-year-old guy. So every Friday night, I was doing hospital work. You don't want to drink, or I didn't, and do hospital work. Every Friday night, we'd go to the pub, my friends and I'd have a couple of beers, because that's all I could tolerate. 1.5, 2 beers, and I couldn't even walk. I was horrible that way. But I think I was so filled with yeast that a little more yeast, like beer, just threw me over. And then Saturday, I'd suffer. Sunday, I'd start to recover, and Monday, I'd go to work. So I'd feel fine Monday through Friday. And I think this is what many people go through. It's a birthday cake. Why can't you have a piece of birthday cake? Well, you can. Who follows this diet? Folks, those looking for optimum nutrition, we're now finding, thanks to the keto diet and other diets, we're now finding this is really a good diet. Sans grains and so forth. And people who are very, very sick. If I had cancer, I wouldn't eat a piece of birthday cake, okay? There's a risk at doing that. Fungus thrives on carbohydrates. Sugar is a carbohydrate. So you have to be very, very careful. If you're looking to fine-tune your body, this is a great, great diet to follow while you're doing that. As you just learned, it's very safe. It's not something I'm going to send you. It's not, the weird camera angles where you can have pizza and it's, like that big. I'm not surprising you. I'm not fooling you with anything. This diet has caused thousands of people to become asymptomatic. They had symptoms and now they don't. That's a good diet. Why one bacterial infection is so deadly in cystic fibrosis patients. Is that so? You know, it's kind of interesting, folks, but we're now seeing in the headlines, just making headlines everywhere, these flesh-eating bacteria, right? This girl zips across a homemade zip line somewhere in Georgia, and all of a sudden she's losing her leg and now her fingers and so forth. Anytime, as is the case with cystic fibrosis, when you prophylactically, you put people on lots of antibiotics so they don't get the CF, the cystic fibrosis, the cough that may kill them. You know, it's really a toxic disease. But in the case of these bacterial, there's now 4 of them. I saw in today's paper, there's now 4 of them, there'll probably be 6 of them and 8 of them and so forth. Anytime you assume that bacteria was what happened to that girl's leg who swung on that zip line, you may be making a horrible mistake. You see, antibiotics feed fungus, they fuel them. And so anytime a patient comes into the hospital that got torn up in the dirt, remember where the fungus lives. Yeah, the bacteria lives there, but the fungus lives there also. I have to wonder, in my May Know This, my newsletter, May of 2012, I gave you Doug's hypothesis on cystic fibrosis. I said, what if in fact, since hospitals are kind of harbors of all this yeast and fungus and bacteria in their duct system, what if in fact this isn't cystic fibrosis? This is an infection of the lungs, but it's fungal. And you start that patient off, honestly and innocently, on antibiotics for years and years and years. You know, studies have supported my hypotheses. There's now some breast cancer studies. The more antibiotics you take, the more vulnerable you are to breast cancer. So that's cancer. What about cystic fibrosis? What about a flesh-eating bacteria spreading because you're fueling it? Are antibiotics the right way to go? Or are antifungals the right way to go? Now you're scratching your head saying, is that so?
Is That So was brought to you by NSC Immunition Products. Let your better tomorrow begin today with NSC Immunition Products.
Look at these shots people are now taking for, to lose weight. The side effects.
What are the side effects of those?
The side effects are so numerous. I could no more put a needle in my stomach.
This is way more prolific than any antifungal side effect. I mean, you got flatulence, thyroid cancer, pancreatitis, diabetic retinopathy, tachycardia, hair loss.
And yet they're running
kidney disease
on this drug.
Yeah, anything to get skinny.
Hi, my name is Erin Porter, and here is a tip on how to handle your sweet tooth when you're on the Kaufmann diet. First of all, try substituting all your sugars. Get Kaufmann-friendly substitutes like xylitol, stevia, monk fruit. And next time you have a sweet tooth, try this trick. Get a glass of ice water and squeeze a half a lemon and a splash of apple cider vinegar and about 6 drops of stevia. And I guarantee you will get rid of your sweet tooth. And the best part is it's antifungal and you're detoxing at the same time while you're getting rid of your sweet tooth. For Know the Cause, I am Erin Porter.
Okay? The Kaufmann 1 diet, okay, we all humans need fats, proteins, and carbohydrates, so we got the fat. Grass-fed meats, poultry, freshwater fish, avocados, nuts, oils, olive, etc.
If we look at it, from 1990, there were roughly, depends on the studies you look at, 1.5 to 3 million cases, give or take, of inflammatory bowel disease, Crohn's colitis, around the world, as per the CDC, being treated by a physician. In 2020, north of 7 million.
Get a glass of ice water and squeeze a half a lemon and a splash of apple cider vinegar and about 6 drops of stevia. And I guarantee you will get rid of your sweet tooth.
The preceding program, Know the Cause, was paid for by Mediatrition Incorporated.